Somehow there's this expectation on health workers that because we went through all this training and have this knowledge and we want to serve others, that we're expected to do things that in no other sector, we don't expect people to show up if they're not getting paid.
As per AMA and WHO data, clinicians' burnout has crossed like 60% globally. And I think admin burden still remains number one factor in driving this. But what stands out to me is not only about the workload, it's about the moral injury as well.
There was a report where the AMA was like celebrating that burnout had dropped to like 50%.
How do voice-based documentation and AI-driven CDI like Fluency Direct and Fluency Align are really helping clinicians to spend quality time with the patients?
5-6 years ago, I had a young 22-year-old woman who came in. She was telling me about back pain. It sounded like just a typical back pain visit. And I kind of look up and she's a little emotional, and I took a pause and I said, "Tell me more about that emotion." And she said, "Well, actually, I'm homeless right now. I'm living out of my car." And you know, on first blush, and just hearing your story, I wouldn't have thought about that. But if I'm looking at my screen, I'm not able to pay attention to some of those non-verbal cues.
What I hear from most clinicians, healthcare workers, is that this isn't resistant, it's about desire for clarity and trust. And also they want that AI that fits naturally into their workflow.
One big thing is explainability. Because all these AI models are different, right? These solutions and models need to be easy for the physician to use and integrate into their day-to-day as well.
The population health insights live in the dashboards, but doesn't always translate into the actions. How is Solventum's HIS are really enabling data-driven prioritization?
That's a key piece, because if you expect frontline health workers to act on something, you've got to make it easy for them to gather those insights and put it right in front of them.
What are the big breakthroughs you believe will meaningfully improve clinician well-being, patient access, and quality care overall?